All right, here we go. We're gonna do a basic brain. So we're gonna enter information. Everything you see in bold, you want to put the information, and then study. We're gonna do a brain, general, and a head. My initials are JZ. No, I'm not the rapper. Haha. And that's how you fill out the patient registration, just to get a patient started here if they're not registered through the RIS software. Confirm. All right, so then you get this tab here. Anywhere you go, you're gonna see multiple types of protocols for your brain. These are the ones for this facility. We're just gonna select the routine. Once again, your protocol might be a little different. For Siemens, to bring the whole card, all you gotta do is hit routine and transfer here. So the first thing it's gonna do is gonna do a localizer of all three planes: sagittal, coronal, and axial. All right, so this is the way this scanner's programmed with this type of field of view or slice selection. I like to change that, and I like a full-on square or rectangle. Now these bars you see here, these are the coils. All right, gray, this is non-select, so this is not a selected coil here, and it's the head coil. We want that on. And then this is one of the tables. All right, so you want to make sure you get the whole brain, all of it, everything included. And then you want to make sure you angle so your pictures come out straight. The first thing you want to do is on the sagittal picture, you want to make sure you're parallel to the corpus callosum here. All right, and then we got the whole brain. Maybe we can go a little bit higher. Right there, you can go through your slices of sagittal. Looks like we got everything. It's a better picture right there. All right, now if you see here, this is your face direction. So we want to make sure that we get everything inside. So we got the nose. If the nose was outside a little bit, so something like this, this nose will come out on this side of the image. So we're gonna make sure we get all that here. All right, everything looks pretty lined up here, and that's because patient is well set up. And here we go, all we hit is apply. Next one here, once again. Now some techs like to go here. I like to get as much as imaging I can, anatomy, into my field of view. I line up everything with the middle of the brain here. Alright, it looks pretty good. Make sure you get all the brain. Don't be shy to add more images right here in the slices. Now if you do add slices, your TR, your TE might change. Here you go, ours is at 470. Now I'm getting more than enough here. My way of doing things is I'd rather give more than less. Looks pretty good, all lined up. All right, apply. All right, next thing we're gonna do, it's gonna be an axial. Now, the easiest way to do this, and I think the safest, is copy from your prior axial, okay, which is our second one here. And to do that, all you gotta do is right click, copy parameter, and we're gonna copy the slices. We don't want to copy the sequence because then we're gonna get another diffusion scan. We just want to copy the slices. We're gonna hit OK and just look at the monitor where all the localizers are, and everything's gonna change. Bingo. Now, I don't know if you guys paid attention earlier. Before, the face direction was right to left, but since we switched it to these slices from this sequence, it switched it to anterior posterior. So I'm gonna hit cancel so you can see that again. I'm gonna open the tab. You see here, right to left. So we're gonna once again copy this, copy parameter, slices, and then OK. Everything changed, including the face direction. But so we're gonna have to go back to right to left. All right. Now here you see the arrow now is pointing right to left. So now we want to make sure anything that's out of this box here on these sides to be inside the box, not outside. Whatever is outside is gonna wrap around. Okay. So it looks like the ears are inside, right? Let's see. Okay. And then we're gonna check our TR. Good. Now let's just say the patient has big ears. You can also just make your field of view a little larger. Okay. But the nice tight is better, okay? Here we go. Got the whole brain and apply. All right. Now, let's do a coronal. We have an axial, we have a sagittal, and we have another axial. But first, let me do another axial that also goes right to left. You see, I opened the tab. And how do you open a tab? You double click, okay? All right, so now this one's right to left. If I copy the parameter from this one here, it's gonna give me AP. All right. I don't want that because then what if I forget to switch it to right to left, right? So what we can do is just copy it from the number 4. All right, for number 4, right click, copy parameter, slices, and look at here, right to left. It's gonna stay right to left because this sequence is also get scanned right to left. All right, and you hit apply. Now let's add that coronal. All right, so sometimes the doctors will tell you, hey, throw in a coronal or throw in this type of sequence. Sometimes you have different sequences on these protocols here. So we're gonna look for a coronal, and there's one right there, a T2. So we're gonna select this. When you only want one of them, all you gotta do is select, all right, and have this gentleman here drop it to your card. Okay. If you want it multiple, all you do is click and control as many as you want, or whichever ones you want, and then this guy will drag them into your card. Okay. All right. So we're gonna bring this coronal up next. So we're just gonna grab it with your left click all the way up, holding it and dropping it. Okay. Remember to open it is double click. Now here, same thing. I'm gonna angle and I'm gonna bring it down. So it's kind of like the same as your sagittal, okay? And once again, we want the whole brain. This looks like there's more than just the brain. So let's take away some sliceless. There you go. All right. And then we're gonna bring a coronal. All right. And I like to be nice and parallel with the middle of the brain. You see that? Bang. Okay. All right, here's gonna be perpendicular to the middle of the brain. Something like that. All right. And a way to find out if you're gonna get all your images that you need, that because we want the whole brain, you can scroll through it. All right. Now, if we were like this, right, we see that we are cutting off here. Okay, see that? All right, so we can add images or we can just move it, you know, and make sure that front to back. I like to go 2 times. One, I'm just looking at the back of the brain here. All right, it's inside. Then I like to go look at it again, and I look at the front. All right, everything's in there. Now we're all set here, but let's look at our T-art. If it changed, it looks like it did, 3390. So let's drop it to 3390. Remember, we want to keep the patient as minimal time in the scanner, okay? The less, the better, but of course, not losing quality to our imaging. All right. So here's the sagittal that we ran, same one, okay? We're about to finish our axial right now. And sometimes it's a good awareness to let the patient know how much longer, you know, and then like that they're aware of, you know, how much time they got left. Okay, sometimes 1 minute feels like 10 minutes in that scanner. All right, so I'm gonna warn the patient that she has 2 more minutes. Young lady, you got about 2 more minutes. Okay, 2 minutes. All right, this is our axial here. Very nice. Very nice. Alright. While the other one's scanning, I can show you some stuff here. These little triangles that you see is just to go through the images. There you go. Well, go back the other way if you like. Right? Alright. And these here, these boxes here, these are your sequences that are going to just be popping. See, that was our localizer, our sagittal, and our axial. And you can put them wherever you want. You want all axials? There you go. All you gotta do is drag and drop, drag and drop, drag and drop. And then another important thing that I like to use sometimes is my reference lines. You can do that by going to view here, reference lines on, so you can see them because they're all sagittal, but throwing an axial up here, boom, there you go. So as I go, that's the slice. This slice is this slice right here. If you want to go the other way, this slice is this slice. Okay, it's a pretty cool little tool. Sometimes when you want to look, making sure that, you know, you see a tumor, a cyst, or whatever, any type of pathology, you know, you want to make sure that you get it in all your planes. All right, and here's our coronal. Look at that. And the reason why you see this is because since it's already scanning this scan here, the next one is not set up, so it's gonna open it for you. Okay. But if we're gonna stop here, because remember, all you gotta do to set up the rest of these TRA is axial, right? So if you double click, right click, copy parameter, slices, okay. There you go. Oh, what happened to these reference lines here? There you go. Apply. There you go. And now this is also an axial. So we're gonna just copy parameter, slices, okay, and done. You are set. This is a little too big. Let's make it smaller. There you go. Okay. There you go. You're set. Patient has what? 4 minutes and 39 seconds plus the scan that's going 130. She has about 6 more minutes, but we're gonna stop here because remember, this is just a basic MRI to teach you how to set it up. And stop.